The XBB variant of COVID-19 has been discovered in Indonesia. And following this find, the COVID-19 spokesperson has said it has a faster transmission rate compared to the BA.5 and BA.2 variants.
Now, cases of XBB variant infection have spiked in Singapore along with higher rates of hospital admission.
So far, around 24 countries, including Indonesia, have reported finding the Omicron XBB variant since the virus was first discovered. So, what are the current number of XBB variant cases? What are its symptoms? Well, to find out more, we're now connected with University of Indonesia's Faculty of Public Health Epidemiologist, Bapak Pandu Riono. Good morning, Pak Pandu. Thank you for joining us this morning.
Good morning.
Could you start off by telling us more about the XBB variant and what makes it different from other variants that we have seen before of COVID-19?
Yeah, we should realize that we are facing the pandemic that dealing with the SARS-CoV-2. It means the mRNA virus that always have mutations. And currently, the mutation cannot be stopped, always. And the XBB variants is a part of Omicron family that with many suggestions that these variants will be more transmissible, and it means that faster to get infected to anybody that have contact with the infection people. It means that maybe the next week Indonesia will have some increasing the cases. Why? Because based the Singapore experience, the first XBB in the first week of September, and Indonesia first time detected in the end of September. It means that 3 weeks difference. And in the middle of October, the Singapore have big cases, and then already declining, and Indonesia began increasing. It means that we will facing the increasing cases in the next week or in the next 2 weeks.
Yeah, we've seen precedents of this happening before with other variants where other countries, we just follow the trend and it's more or less very similar.
And some sources say that the XBB variant spreads quickly, but the fatality is not damaging as Omicron. Is that true, Pak?
Yeah, this is very... the news is related with all the Omicron family is less severe compared the previous variants. It means that even we have a new variants, but still less severe and less fatality. It means that even the number of cases increasing, maybe some of them is doesn't have some symptom or mild symptoms, is like flu. And the important, even they have less symptom and almost or mild symptom, they should isolate themselves because this kind of infection is more transmissible to other people, especially old people.
Okay, but we also want to know, so far, what are the updated numbers so far of XBB variant cases in Indonesia? And is it possible that this time around, the numbers of positive cases could be lower? Or are we not really focused on that anymore? Are we just looking at fatality numbers to make sure those don't go up?
Yeah, actually, we dealing all the infections, the cases.
Yes.
Infected cases, but unfortunately it depends on the testing. If the testing is low, the estimations number of infected cases is become low. It means that depend on the activity of testing. But the data, more solid data on the hospitality. The hospitality means the severe cases. The severe cases, the statistic is still at least still consistent. Even they're increasing, but the increasing is maybe from 4 until 8. This is very fortunate, and also the fatality is also still not significant increase.
Okay.
It means that we are dealing the less severe and less fatality pandemic. That it means that we should not become fear of the new variants.
Right. I think everyone is thinking that, oh, we're now going through endemic phase where we try to live with COVID, but then new variant keep on emerging. Is that actually normal, Pa, as we go through the endemic phase?
Yes. Why we will go to endemic phase? Because we already success to provide vaccinations to the people. It means the level of immunity in Indonesia is more than 90%. The data show 98%, but still some of the people like old people and some people with comorbid not yet getting the booster vaccine. It means we are depend on the immunity, and even like flu virus, every year the vaccination should be updated because they already always mutations. It means that even the variants always occur or always happen, the new virus, new type of virus. You know that currently in the world we have 300 subvariants that circulate among people in the world. But even 300, the dominant still some of the variants like XBB, BA4, BA5. Indonesia is currently dominant is BA4 and BA5, but even more faster to transmit to the people, but less severe and less fatal.
Okay.
This is important to us.
Yeah, this is a trend that we've been seeing with the last few variants as well. So I've got a couple of questions actually. So let's continue on what you were talking about, the vaccines and the boosters. We do know that, and this is true for other vaccines as well, that they are sometimes adjusted or readjusted in order to suit or fight off the latest variants. What is it like now with COVID-19? I do know that obviously pharmaceutical companies do have to keep up with the latest variants, but do people still need to still get their vaccinations and boosters in order to avoid new variants such as the XBB?
Yeah, I think the important is Indonesia is should have 3 injections. I mean the 2 primer and then 1 injection for booster, because the third vaccination, the data show is boost the immunity level among the people already got the booster. And some country like in US or Europe, they already go more booster, the second booster, but they already updated the vaccine. The vaccine that already updated can dealing with the Wuhan variants, the old variants, until the Omicron variants. It means that our immunity is depend on the simulation or training by vaccine. The vaccine should be provide updated virus, because if our immunity doesn't recognize the new mutation, it means the worse for vaccination, worse for the immunity. The immunity should be protect us for any variants.
Okay, just a side note, a side question here then, Pa. Is it possible, do you see us being able to, because I'm seeing a progression where symptoms seem to be getting milder in most cases. The variants are starting to get either weaker or we are getting stronger. What's your opinion on this, Pa? Are we always going to have to rely on a vaccine and booster for years to come? Or are we slowly starting to build this natural kind of, at least better immunity against COVID-19 since compared to the very, very beginning?
Yeah, this is situation that currently we have in Indonesia. Before we have program for vaccination, half of people in Indonesia already have immunity because natural infections.
Right.
Yeah, it means that, and then the governments provide the vaccinations. It means that I always said we have immunity vaccine by gods and booster by vaccine by governments, by Jokowi administrations. It means that actually we already got booster more than 3. natural immunization, natural infections, provide the immunity, and then vaccination. This is build the strong immunity. That's why we are confident that the end of this year we will end this pandemic and move to the new endemic. And in the future, hopefully, the mutation will be less severe because currently we have some genomic surveillance. Even we have 300 subvariants, but almost all 300 is the same. Less severe, less fatal. It means that our immunity is enough to dealing with any new variants in the future. This is our hoping.
Okay, that's music to my ears. But
Yes. Would you recommend us to get another booster as well, even though, you know, as you said, the symptoms are getting milder, the virus are less aggressive? Would you recommend us to get another booster still, to just making sure that we get enough immunity to fight another new variants when it comes up?
I think the third booster, the third injection, first booster is enough currently for Indonesia. Hopefully, we don't need to have another booster because we are, many people doesn't want have vaccination every year or every 6 months, you know. Actually, we hope that our vaccine is provide enough immunity to dealing with any variants.
Okay, but real quick, so let's have a real quick summary of the XBB variant itself. Just to recap for our viewers as well, are there any different symptoms that we have seen so far from XBB compared to any prior of the similar variants from before? And what are some of the things that we need to do to avoid catching the XBB variant of COVID-19?
Yeah, the vaccinations, the immunity not prevent for the infection.
Right.
That's our concept.
Right.
It means our immunity is to combat the invasive virus to get severe or to get fatal. But the infections can be prevented by using masks. You know, many in the country have some bring back the mask because they are very afraid of the new variants. It means that the symptoms is not almost the same with flu. Sometimes we cannot differentiate. This is flu or this is COVID infections. It means that hopefully in the future is the COVID will be like flu illness. You know, we are in the future will have some surveillance. Not only COVID, but flu-like illness. It means that any symptom like flu, if they're increasing, it should be COVID or flu.
Okay.
It means that some country already dealing with the new vaccinations, that COVID plus flu vaccination.
Oh, really? Wow. That would actually be
Yes.
very convenient because there is a lot of flus going around, especially in this rainy season.
Yep.
That's true. Currently, we have some increasing the flu and also increasing the pneumonia. It means
Pneumonia.
pneumonia.
Well, I guess we are currently now a bit more laid back with the health protocols. I see a lot of people are not wearing masks because we feel pretty safe. And now this new variant coming up, emerging, and I think, as you mentioned, bringing back the mask is always a safe measure for us to prevent to get infected.
Thank you, Pa, for your time and joining us this morning to discuss this latest development. And we hope to check in again with you soon. Have yourself a great weekend.
Thank you so much, Pa.
Thank you. Good morning.
Take care.